Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead.
Thank you, Chrissy, and good afternoon, everyone. Today, we mourn another loss of an individual at Northwood due to COVID-19. On behalf of Nova Scotians, I offer my condolences to the family and loved ones. And to the resident staff and frontline workers at Northwood, we are thinking about you too. It is a difficult time at Northwood, but we are making progress, and we won't stop until the virus has been defeated. And we thank you for the work that you're doing on behalf of all of us at Northwood. I hope everyone had a good weekend. I want to thank everyone for cooperating. The photos I saw of family and friends reuniting were heartwarming. In the days and weeks ahead, we will be talking about lifting additional restrictions to get you outside more, to do more, and to see more people. A lot depends on what Dr. Strang sees in terms of flattening the curve in the weeks ahead. We are also focused on our economy. Dr. Strang, working with Minister McClellan and his department, will complete consultations by the end of this week, and this is an important first step toward reopening our economy. We can't have businesses opening without understanding how to follow the public health protocols that will be in place. I know many of you who own business have experienced financial loss and hardship, and we have not forgotten you. We think about you every day, and we try to balance the safety of Nova Scotians with restarting our economy. In this first step, we want to finish the consultation. We want to follow up to make sure businesses are ready, and we want everyone to be focused on what they have to do to welcome their customers back safely. If we get this right, we could be ready by early June. Now I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I, too, want to offer my condolences to the family and friends who are mourning the loss of another individual who lived at Northwood. We now have 56 Nova Scotians who have died due to COVID-19. Today, I'm reporting one new case of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,044. The one new case we're reporting today is a resident at Northwood. Yesterday, the QE2 lab processed 384 tests, and we currently have a total of 9 individuals in hospital. 5 of them are in the ICU. 956 Nova Scotians can now be considered to have recovered from COVID-19, and we've had a total of 36,438 people who have been tested but have negative results. We have 2 licensed long-term care homes or unlicensed seniors facilities with active cases of COVID-19. One of them is the Northwood in their Halifax campus, which has now 19 residents and 7 staff with active cases. So that the number of active cases at Northwood continues to go down, which is good news. One other facility has a single resident who's considered still an active case. While we're coming out, we're clearly coming to the end of the first wave. It's important that we still have ongoing surveillance. It's important that anybody who has symptoms that could be COVID, that we still need to test people. So again, we need anybody who has 2 or more of the following symptoms: fever or feeling feverish, headache, a sore throat, runny nose, a new or worsening cough. If you have 2 or more of those, please contact 811 online if possible, if not calling them to do further assessment. Since we were last here on Friday, we have had 10 new cases over the long weekend of COVID-19. 3 on Saturday, 3 and more on Sunday, and 3 on Monday, and 1 more today. All of these 10 cases were in Central Zone. And while we're still continuing to do the contact tracing, our information so far is 5 of those 10 were cases of residents or staff at Northwood. Another 3 were contacts of a known case, so we know where they were likely exposed. An additional case is travel-related. The low case numbers over the weekend, it really is good news, and it continues to be encouraging of how we see the epidemiology evolving. It means that everything we've we've been doing, knowing that what we saw over the weekend was what really impacted over the last week to 2 weeks of where people might have been exposed, everything we're doing is working to slow the spread of the virus. However, we still have to understand that of those 10 cases, one of them would appear to be the result of community spread. So that means that we've done our case follow-up and we have not been able to identify a clear source. Therefore, we have to conclude that the exposure must have been somewhere here in the community in Nova Scotia. I highlight this because it remains that while things are progressing and the picture is encouraging, that we need to continue to remain vigilant. We're not completely out of the woods yet, and we need to kind of continue with all our measures around social distancing, hand washing, etc., and pay attention to preventing COVID-19. On Friday and over the weekend, we shared information to help guide Nova Scotians in making more social connections as we loosened some of our restrictions. This was an acknowledgement of the critical importance that connecting with family and friends is so important for our mental health and the cohesion and adherence of our communities. What everybody's been doing, staying home, away from others, goes against all our human nature and our natural instinct. And I know how hard that has been for people. On Friday, after we spoke, I knew many people identified their family household bubble and were able to reconnect, whether it was siblings, grandparents, or close friends, after 2 long months. For those who did not have family nearby, who do not have family nearby or do not wish to reconnect with family for other reasons, the option was given in those cases to connect with another household. Ultimately, we're saying that if connecting how you define which family or an individual that you want to make a bubble with is ultimately your choice. But it's important that you do that carefully. No matter how you define the household or an individual that you bubble with, that it's important that as you make those agreements that these are mutually exclusive, that you're agreeing to connect with each other and not have to worry about social distancing. But anybody outside of that needs to maintain you need to maintain social distance with. This is important that this is a first step. Recognize that it doesn't address every individual situation, and that some people are still feeling frustrated that they haven't been given an opportunity. But we have to do this slowly and carefully. And so what we announced Friday is a first step, and we'll continue to move forward in increasing opportunities for social connection, but in a slow and careful way. I want to reiterate the kind of how to do making choices around who you bubble with or which household you bubble with in a safe manner. It's important to consider age, occupation, and health condition. Ask yourselves the 3 key questions. Is anybody in the households that you're thinking of getting together at higher risk for severe disease from COVID-19? Whether it's because of age, 65 or older, especially if they're elderly and have underlying health conditions, but there also may be people who are younger than age 65 but have a significant chronic health condition or are immune suppressed that are at high risk as well. You also have to ask, do any of the people that you're connecting with, do they have, through their occupation, have frequent contact with the general public, or some other way they're at higher risk of having ongoing exposure to COVID-19? And the last piece is, even if you decide that you're going to get together as 2 households, that if any one person in those households is unwell and have symptoms that could be COVID-19, it's critically important that the households don't get together until that individual has undergone the further assessment through 811 and testing if necessary. It's important that underlying health status is critically important, that as you make these choices, because we know that people can be at significant risk for severe disease because of their underlying health. It's important that we make choices, as we make these choices, that we're not allowing conditions for the virus to spread, especially to those who are at higher risk. I also want to clarify that even though we were talking about allowing opportunities in a limited way for small groups of people to get together without having to worry about social distancing, that we also have lots of opportunities for people who can get together in-person social interaction while you're still respecting social distancing. So it's certainly okay to have planned social gatherings with friends, with your neighbors, but you need to do that in a way that maintains social distancing, and you can have up to 5 people at this point in time. We need to make sure that we're doing these kind of having these planned social activities in limited numbers and keeping the social distancing, not giving the virus a chance to spread. If you're having these planned social gatherings in small numbers, outside is always better than inside. Sitting in your driveway or in your backyard. You can do that, again, as long as you're maintaining the social distancing. No hugs, no handshakes, and it's important that if people are using this as an opportunity to have food and beverage, that everybody should bring their own. Don't share food, don't share utensils or anything else, and we really ask people to respect and think carefully about careful hand washing as well before they get together. It's the same advice we give as we've opened up outdoor activities, so people can still do a broad range of outdoor activities. But if you're within your household or your household bubble, you can be close together. But anybody else who's outside of that, you need to maintain the social distancing in that range of outdoor activities, whether it's parks, trails, some of the activities we opened up on Friday: sailing, paddling, golf, tennis. Respecting social distance is critically important. It's that 6 feet is really important, because it's that if you're 6 feet apart, the virus cannot spread from one person to another. So that's why we emphasize so much of respecting that social distancing. The only way we can continue to loosen the restrictions is if we have ongoing commitment to these public health requirements, and that's what's going to allow us to keep our case numbers continuing to be low and advance in opening up our society and opening up the economy, as the Premier has outlined. I understand that it's been 2 long months and people are anxious to get together, but we're asking everybody to be slow and careful and be cautious, and if we all work together, we will get there over time. Thank you.
Thank you, Dr. Strang. And Chrissy, we'll be happy to take any questions.
Just a reminder that reporters will get 1 question and 1 follow-up with the time that we have for today. First question goes to Global's Jesse Thomas.
Thank you. I guess this falls to, I'm not sure who it falls to, actually, sorry, either Dr. Strang or the Premier, but as we're looking at lifting additional restrictions in the coming weeks, and, we start to put more focus on the economy, when are we going to start to see some clear communication of the plan, if there's phases of reopening, and what that can look like? I know for a lot of the public, it's some of the anxiety of not knowing what's coming next, although that bubble announcement was good timing. I think a lot of people are wondering what the greater plan is, and can that be shared in more detail?
So one of the things I think is important, and I really appreciate this question, Dr. Strang is working with the associations that represent the businesses that we've closed down and laying out what are the public health protocols in how to operate. When we're ready to open the economy, it won't be certain sections of the economy that will open. We'll open them. We'll open it together with the public health protocols in it. Those are being communicated now. They have been for over a week with the associations. Dr. Strang has clearly laid out in terms of the social distancing, 6 feet apart, lots of hand washing will take place in some of the businesses that would be out there that you'd have to follow. But in other ones like cosmetology, there's specific things that we would have to, that he's communicating to that association around how do you protect your customer. The same thing with restaurant associations. We're communicating with them so that they'll be able to then go out and tell their members so that when we open up the economy, it will open when we see the right curve and the right epidemiology shows it's ready to go. But we'll be opening up all of those sectors that were closed. I also want to emphasize construction sites are still functioning, road building still happening. We're seeing activity take place in our province. I've been pleased to see a number of businesses opening up with takeout that had closed completely, all looking starting to realize that we're working our way through this and preparing their business for the opening of the economy across the board.
Jesse, do you have a follow-up?
Thanks, Chrissy. I guess a question for Dr. Strang. Will we see a detailed presentation maybe in the coming, after the week after you have these business conversations? Will we be able to see a direct communication in terms of phases and what the reopening looks like, so people can at least, see beyond maybe the day-to-day and week-to-week?
So as the Premier said, as we get through the consultation and apply also the public health framework, decisions will be made. Clearly, we need to communicate that first to the various sectors, but also the public needs to understand. So the answer to your question would be when we're ready to, phase one. As for ongoing subsequent phases, I think you need to be clear. We have to understand exactly what we're going to be doing, opening up the economy in if you call it the phase one, and what additionally we might need to do. But again, the decisions on that will depend on what is the impact of our initial steps in recovery and how does that affect the epidemiology of COVID-19. So it's an ongoing process that we're not going to go commit ourselves either a timeline or details of what the future might be. We'll go through this step by step, working with a range of sectors and understanding what each step along the way is. And once we figure out those details, then engaging the public to make sure the public is well aware of what's coming next.
Next question will go to Keith Doucette with the Canadian Press.
Good afternoon. I think this is for Dr. Strang. In terms of getting this right when we finally do open it up, when we look next door to New Brunswick and across the water to Newfoundland and Labrador, both of those provinces now are approaching 2 weeks without reporting a case. PEI, everybody who had it there, and it was very small numbers, has recovered. So our first priority is obviously Nova Scotians. But is there extra pressure on this province because it was hardest hit to get this right for the region? Because at some point, obviously, the borders, the provincial borders at least, will be reopened.
So I'm not feeling any pressure from outside of Nova Scotia. My job is to give advice to the Premier on how do we move forward and appropriate as quickly as we can, and finding the balance between controlling COVID and reopening the economy and society. And we've said all along that is a slow, careful process. But I'm focused on what's right for Nova Scotians, not anything from outside of Nova Scotia.
Keith, do you have a follow-up?
But with respect, what's right for Nova Scotians would be right for the region, would it not, because of the closeness and proximity of our neighbors? Just putting it out there.
We are interconnected, but also we have different epidemiology. We have a different epidemiology in Nova Scotia, based around. We have by far the largest urban center with international travel that the other three provinces don't have to nearly the same extent. So our first priority is to get things right within Nova Scotia, and then working. I have lots of conversation with my chief medical officer of health colleagues, especially in PEI in New Brunswick, and I know the Premier has ongoing conversations with his colleagues, but we're focused first and foremost on Nova Scotia.
So, Keith, as we continue to work our way through dealing with public health and the epidemiology and making sure that we flatten the curve here, to your point, there is ongoing conversations of what would the potential summer look like in Atlantic Canada with our sister provinces. We've had a very different scenario here. Obviously, when you look at the region, we have the largest metropolitan part in Atlantic Canada, Halifax, obviously, which was hit. And quite frankly, I say this with all due respect to my colleagues in Atlantic Canada across the country, it is the crown jewel on the East Coast. So obviously people want access to this part of Canada, this part of Atlantic Canada. So those conversations are ongoing. We know a lot of people in all of our provinces who own property. Some, as you would have heard, own property in New Brunswick, PEI. How can we best communicate that with those while ensuring that we've flattened the curve with COVID at the same time with an emphasis and a look towards the economic security of some of our community members.
Next question will go to Mike Gorman with CBC.
Thank you. Dr. Strang, you talked today, and you've talked about this previously too, about the fact that the lab testing numbers have gone down over the last few weeks. And I wonder, obviously part of that is because people aren't exhibiting the symptoms that would require them to come through. And as you say, contact tracing has also worked. But I wonder, what approach can you use, or are you considering, to ensure that monitoring is happening as effectively as possible? So should this thing crop up again, because we know the disease isn't going away, you're able to get on it as quickly as possible?
So thanks for the question, and yeah, that's a lot of our conversation, both at a national level and here in how that national conversation informs our thinking going forward. It's very clear that we have to maintain our capacity, and I think it's been a foundation of how well we've been able to control COVID here in Nova Scotia is easy, rapid access to testing. The work the health authority has done to establish testing centers, our work with 811 to have a very streamlined kind of a set triage process first. That's worked very well. We need to maintain that. We also need to think about how we can take advantage of moving forward of the test we have. It has limitations in terms of using it broadly to test a large number of asymptomatic people, but how could we strategically test in certain settings or certain populations? And that's an ongoing discussion we're having with our clinical colleagues, looking at that as what actually makes the most sense. How do we do this strategically? We know that the lab, just because the lab capacity is there doesn't mean we have to use it, but what we do have to have is maintain that surge capacity if and when we need it, then also use within that capacity, use what we need to do from a strategically inform, as you're pointing out, to some kind of ongoing surveillance and making sure that if we do get start to see an increase of COVID-19, that we are detecting that very early.
Mike, do you have a follow-up?
Yeah, thanks. To what degree, Dr. Strang, are we limited by that test? And are there other approaches, testing methods, screening methods that could be considered or are considered so that they aren't, they don't have to wait for the same level of symptoms that the existing test requires before you can use it with confidence?
So the current test we have is based on the presence of virus, and you test positive for some virus genetic material. But we know that if you use that test to test a large number of people who have no symptoms, the probability of having anybody there test positive is low even before you start testing. So you're going to get a lot of inaccurate information, and so we just have to understand that. We talk about in public health terms. The likelihood of somebody being positive or a population being positive before you test them determines how effective your test is. So we just have to understand that. There is work going on now on a serologic test to test for immunity. That's just been licensed in the last week in Health Canada. So that's different. You take a blood sample rather than a swab from the back of the nose or throat, and you're actually looking for signs of immunity, immune response that somebody would have developed after being infected. There are different uses for that test that we're looking at as part of national conversations. So the whole testing strategy and what that looks like moving forward is a significant focus right now of conversation amongst chief medical officers of health across the country with our colleagues in the national lab, as well as Health Canada, who licenses and does the review on the evidence of various testing methodologies.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is a question for Dr. Strang. I was surprised to hear you say that one of the recent cases is related to travel. Just wondering how that's possible at this point, given the restrictions on travel and the monitoring at the border and so on.
We have people who are moving across the border. Part of we have made exceptions and people for the flow of necessary goods and materials. It's somebody involved in that kind of occupation that became symptomatic, is my understanding, and was tested. So even though our borders are restricted, we still have various types of occupations that are involved in moving goods and materials back and forth across our interprovincial and even some of our international borders.
John, do you have a follow-up?
I do. We've heard warnings from the World Health Organization and chief medical officers in other countries that COVID may never fully go away, that it in fact could become endemic. How is Nova Scotia preparing for that possibility?
So I'm well aware of those conversations, and that is part of as we develop our recovery plan. It's the things we're asking various businesses to put in place, various other, whether it's the sports, recreation, the arts community. It's a key point that I make in all my consultation. It's just because we're coming out of wave one doesn't mean the pandemic's over, and I think that's a really important message. We're moving into a new normal, which is here for a significant period of time, which is living with COVID. So all the things we've taught that I talked to them about that are necessary to reopen or expand if they remain open, to do that safely. Social distancing where you can, hand washing, all those pieces, those become part of our new normal and are here for a long period of time. And I think it's something, we're going to be talking more to Nova Scotians about that. It's not going back to 2019 pre-COVID. This is a new normal. And we need to think about how we actually all ultimately have to accommodate and things are going to be different to minimize. It's not about having no COVID at all. It's about being able to do things that control the spread so we don't overwhelm our health system, and we're protecting as much as we can those who are much vulnerable to severe disease.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Premier, you said you were looking at early June if we get this right. There are only 12 days left in the month. Should businesses begin to call back laid off staff, install petitions? And how do you plan to communicate the reopening plan to businesses that aren't part of a greater association?
Well, we've gone through those businesses that have been shut down due to the order. So we are dealing with all of those associations and working with an understanding that we've had an impact on businesses who may not have been forced to close because of a particular health order, but because their customer base was staying home and following public health orders. So Minister McClellan is continuing to work with sectors through his department across the province and communicating to them the public health protocols that will be required to be followed. And we'll continue to do that. And as I said, we'll go through this week. There'll be part of next week. Today is the 19th. So we have a couple of weeks heading into June. At that point, we'll have communicated to everyone in advance of that when we expect the economy to open up, and we'll continue to do that in collaboration with our partners.
Lindsay, do you have a follow-up?
Yes, thank you. A Dalhousie psychologist projects that deaths by suicide in the province are likely to rise based on the impact of unemployment and isolation. He said the public health risk might outweigh the risk posed by COVID-19. We've been talking recently about the importance of mental health, but are you taking the impact of unemployment on mental health into consideration in your go-slow approach to reopening businesses?
As I said in my remarks, it has been part of our general conversation every day, the economic future of Nova Scotians. People who have invested their own money to drive an idea, to create a business, to create economic opportunities for our sons and daughters, to hire people. They've been what's allowed our economy, quite frankly, to be one of the leading economies in the last number of years in Canada, so the activity and the investment that's been taking place by the private sector. So, of course, that has been part of our thinking as we go along. But I think all of us, including those who are financially being hit hard by the steps that we've taken, want us to get the public health part right, want us to make sure that we do all we can to flatten the curve of COVID, to eliminate the community spread as quickly as we can, because when they do open, which will require investment, when they do reopen, they don't want to be forced to close in a few weeks. So that's all been part of that conversation. It's what's the right timing? When we look at the epidemiology and what public health is doing in terms of flattening the curve, when do we get to the right point where now we also need to start moving the economy for the very things you're describing? We've reduced the risk substantially. We've put in place the right protocols. And now it's time to let the private sector begin to do what they do best, and that is to serve Nova Scotians and grow an economy.
Next question will go to Kyle Shaw with the Coast.
Hi, Dr. Strang. You gave me a positive answer the week before last when I asked about changing the case map on the province's COVID site so it could show active cases in each health zone, and not just a cumulative number of cases. And then last week you had a data cleanup that improved the stats and got us to a more current situation. Does last week's data cleanup help bring the MAP project forward?
Yeah, that was part of the discussion, and you flagged for I need to go back and check with my team where that is at. I mean, the data cleanup was part of it. There was also conversations with our privacy folks around how do we represent numbers when the case numbers may be very small. How do we do that in a way that respects privacy? But those conversations are still ongoing.
Kyle, do you have a follow-up?
Yes, thanks. Okay, that's cool about the maps, Dr. Strang. Now, about Northwood specifically, I had a Coast reader come to me, and she was really concerned because she's hearing people speculate. It's a repellent thing. The speculation is that it's not unusual for seniors to be passing away at Northwood, and so the theory is that COVID isn't actually causing a higher than normal death rate. Can you address this theory, which is apparently a thing, that no more people than usual are dying in Northwood and that we're making a big deal about nothing?
So that's absolutely incorrect. I've had lots of conversation with the director at Northwood, understanding this. We know that any long-term care facility, that there's a percentage of people you look at any month who die. That's just the reality of people. They're at their end of last stages of their life in a long-term care facility. But it's very clear when you look at what's going on in Northwood that their monthly mortality rate in the last couple of months is significantly higher than it was when you compare it to those same months, for instance, say a year ago. So there's no doubt that COVID-19 has had a substantive impact on Northwood, and nobody should be trying to dismiss that.
Next question will go to Bill Martin with 6 Rivers News.
Thank you, Dr. Strang. I've asked you this before about the possibility of taking action to release the restrictions in the region, the health regions that are not showing any growth. And you said we're in this together as Nova Scotia. Yet today you talked about the Atlantic, saying you really want to go by the epidemiology. Well, the epidemiology suggests that what's happening in the central zone far, far outweighs what's happening in the other 3 zones. Could we not relax some things for those 3 zones in anticipation of the central zone following later?
The risk we would play in doing that is that even if there is some community activity here in HRM, that if we open things up, whether it's entertainment, whether it's shopping, etc., we're going to have people moving with it, and we take the virus into areas that have had very low activity, and we reintroduce the virus there. So we've been very clear that we're going to have a sector by sector approach and not a geographic region approach.
Bill, do you have a follow-up?
Thank you, no.
Next question will go to Paula Diane Perez with CHNE TV.
Thank you. My question today is, are seafood processing plants being inspected specifically for COVID-19 safety measures?
So we know we have work with the whole fishery sector, the fishing industry. They have an ongoing process, like any business, where the labor and advanced education, their occupational health and safety division, who's responsible for OH&S standards, for labor standards, they would come under the same kind of requirements that any business that continues to operate that they would have had before COVID-19, and certainly. Lots of conversation with my colleagues in the Occupational Health and Safety Division, and they're well aware of their specific requirements related to COVID-19 that have always have been in place for businesses who have been able to remain open.
Paula, do you have a follow-up?
Yes, thank you. And can that information be made available to the public on a regular basis?
So what kind of information are you looking for?
Well, for example, here I'm calling from Shetty Camp. The community is concerned about the seafood processing plant, and but they don't know. We don't have access to what's going on, if everything's okay or not. So how can we reassure the community?
So I think that that's if there's specific concerns about that plant, and then you don't have to, and people are concerned about specific circumstances, they could bring those forward to the Occupational Health and Safety Division, whose job it is to monitor that. I will say that in general in the Shetty area, there's been a substantive amount of attention paid to with fishers coming from other maritime provinces. I've been heavily involved in putting appropriate rules in place for those to operate safely. The officials from both the Department of Environment and Fisheries working with local law enforcement to do both checks ahead of time and ongoing monitoring in general for the fishing industry, with a specific focus on the Shetty area.
And that's all the reporters we have on the phone for today.
Thank you, Chrissy. This was another sad day for Nova Scotians. On Sunday, Captain Jen Casey, a member of the Snowbirds and native Haligonian, died in a terrible accident. From everything I read, she was a proud Nova Scotian and a natural-born storyteller who died doing what she loved, inspiring others. It's a tragic loss for her family and friends here in Nova Scotia and across the country. And to all of you, I want to extend deepest sympathies on behalf of all Nova Scotians to you. We have been through a lot here in Nova Scotia. Today marks 1 month since the horrible, senseless crime that took the lives of 22 Nova Scotians. Their family and friends are still coping, and we want you to know that we are thinking about you. In the same way that we are thinking about the families of the 6 members of the Canadian Armed Forces who died when the helicopter crashed off of Greece, and the families of 3-year-old Dylan Eller, who is still missing. And let's not forget all those who have died from COVID in our province. So much death, so much sadness, and it's hard to cope, but we have to. It's who we are resilient, and we are strong. We need to grieve, and we need to feel. To the families, take your time. To the rest of us, we need to honor those whose lives were lost by continuing to be proud Nova Scotians who support one another as we rebuild our communities and our economy.